Right now, our skies are filled outside with haze and smoke, and for some, it's making it hard to breathe. The dense smoke blanketing the Wasatch Front keeps blowing in from hundreds of thousands of acres on fire out west. And breathing in all this smoky air, some Utahns are telling ABC4 News it's hurting their throat and lungs. So we wanted to know, what's it doing to your health? Joining us to explain what it means for you is Dr. Liz Joy here from Intermountain Healthcare. Liz, we appreciate you being here with us this morning. We're really worried about how this smoke is affecting us. How concerned should we be?
People with underlying health conditions like asthma or heart disease, pregnant women, young children, those are the ones who should be particularly concerned. But really all of us, may be at risk as a result of bad air. I use myself as an example. I went for a long hike yesterday morning, and I'm still struggling today as a result of that air exposure.
You sound a little scratchy.
Absolutely, and I feel a little scratchy.
Yeah. And so what is this doing to our health, breathing in all this dirty air?
Well, wildfire smoke is filled with particulate pollution, gas pollution, ozone. All of that creates inflammation in our airways, and inflammation, the really small particles, create inflammation in our blood vessels. And so that's where it becomes problematic for people with underlying heart disease. They've had a heart attack, or maybe they've had a stroke.
So what are some of the symptoms that people may be experiencing if they're breathing in this air and they will now notice it's affecting them?
Cough, shortness of breath, chest pain, sore throat, itchy eyes, runny nose. It's the combination of the wildfire smoke plus underlying summer ozone pollution, maybe some allergies thrown in there for good measure.
Yeah, well, you have a little bit of a recipe for everybody, especially you mentioned the people with respiratory problems.
Yes, and people who have known airway disease like asthma or chronic obstructive pulmonary disease, they should definitely consult their physician to know when they should avoid bad air, and they should carry their inhaler with them. If they have a prescribed inhaler, they should use it as directed. So
you have some people, there's a few suggestions for those with asthma, but what about everybody else who may not have one of those respiratory problems but wants to avoid breathing in this bad air and affecting their health?
So I think the most important thing is people are informed, right? Download one of the air quality apps to your smartphone. I like airnow.gov. And I can look at it in the morning and make a decision about what I'm going to do that day in terms of outdoor physical activity. I just checked this morning on my way in, and it was at 44, which is in the green zone. So
that's good, okay.
This morning is a good morning to do outdoor activity if you have the opportunity.
So really it's the idea of staying indoors when you can.
Yes.
Using the information to kind of make smarter choices. Anything else we should do?
When the air quality is bad because of wildfires, like right now, think about other ways that, we can all contribute to making better air. Drive less. Carpool.
Be proactive.
Absolutely. Use all the other strategies that we do in the wintertime during our inversions. We can apply those same strategies for the summer.
And of course, if we want to get more information, how do we connect with Intermountain?
If you go to Intermountain Healthcare and learn about our sustainability and air quality webpage, you can learn more there. And I'd encourage people also to check out the UCare website.
And of course, we'll have a link to that information on our website, abc4.com/GMU. Talking this morning here with Dr. Liz Joy from Intermountain. Doctor, thanks for being with us today.
Yeah, my pleasure.